Blepharitis is a condition in which your eyelids become inflamed. Ultimately, the symptoms that patients experience are gritty eyes, sore eyes. These eyes tend to look red, and essentially the eyes also look puffy. Blepharitis is a condition which is known as being a recurrent problem, meaning if one tends to get the condition, it can come back from time to time. That is why lid hygiene is very important in keeping the condition at bay. Rarely, blepharitis will affect one's vision. In this video, stay tuned to learn all about blepharitis. Blepharitis is a condition that affects the eyelid margin. It can occur in association with infections and also in association with skin issues that may be underlying and that may be exacerbating the problem from time to time. The condition is very annoying and frustrating for patients that tend to suffer with it. However, thankfully, it does respond well to treatment. Blepharitis is also a condition that is frequently referred to as a bilateral condition. This simply means that it affects both eyes, although patients may find that their symptoms are worse on one side compared to the other from time to time. Although frequently patients use the term blepharitis to describe their eyelid inflammation, if one thinks of blepharitis in an academic sense, typically three forms of blepharitis are described. The first form is a staphylococcal type of blepharitis. We normally have a plentiful supply of natural bugs which live on our skin, and they're typically confined to the surface of our skin. However, from time to time, these bugs can actually get into our skin and can result in some form of a reaction. Typically in staphylococcal blepharitis, these bugs, typically the staphylococcal form, will get into our eyelid margins and result in a localized reaction. The second form of blepharitis is seborrheic blepharitis. This is very closely and intimately related to seborrheic dermatitis, which is when one tends to get oily and scaly skin, which can result in rashes and also extreme dandruff, typically affecting the upper extremities of our bodies. This tends to also result in blepharitis in certain patients. The final type of blepharitis is referred to as meibomian blepharitis. In both our upper lids and lower lids, we have meibomian glands. These are responsible for secreting an oily substance which contributes to the outer layer of our tear film. When these glands get blocked, which can happen from time to time, that then tends to result in an inflammatory process which results in a meibomian blepharitis. Naturally, in practice, the definition and the division of these three can sometimes get blurred, and some patients do actually have a combined form of blepharitis. In terms of the symptoms of blepharitis, they are vast. For example, patients may complain of gritty and itchy eyes and stingy eyes. What tends to happen is one's eyelids may become stuck together via their eyelashes, and when bits of crust break away from our eyelashes and get onto the surface of our eyes, that can then result in irritation and secondary watering of our eyes. This can also result in a generalized puffiness and red appearance of our eyes, and patients tend to find that they are constantly trying to blink in order to try and remove these, what some patients describe as bits of sleep that accumulate within the eyelid margins and therefore get onto the surface of their eyes. Patients with blepharitis tend to describe how their condition comes and goes, and that naturally mimics the disease process, in so much that the condition is a chronic condition that can relapse and remit from time to time. So this will further determine the importance of regular lid hygiene to keep the condition at bay. We will go into this in more detail in the treatment section of this video. It is important to remember that blepharitis typically affects both eyes. However, from time to time in certain patients, the condition may be described as being asymmetric, and that simply means that despite both eyes being affected, one eye may very well be affected more than the other, and therefore the patient will experience symptoms in one eye more than the other. Typical complications that can result due to blepharitis include patients describe how they may have a lump within their eyelids, and this is due to a blockage of their meibomian gland and or glands, and what can happen over time is this gland can enlarge in terms of the blocked area, and this results in what is known as a chalazion. The second complication that can occur due to blepharitis is what is known as a stye, and this is when an infection makes its way down to the eyelash root or follicle. Patients who wear contact lenses typically describe how when they are experiencing a flare-up of their blepharitis, wearing contact lenses no longer becomes a pleasurable experience, and they can suffer tremendously with dry eyes and irritable, gritty eyes. Other complications that can occur due to blepharitis include eyelash problems. For example, if the eyelashes are stuck together, or if the eyelashes are in some way inflamed, or rather the eyelid margin is inflamed, what can happen to the eyelashes is they can change direction, and instead of projecting outward, they can sometimes project inwards due to a change of direction, and that can then result in ocular surface irritation. It is important to stress, however, eyelash changes typically tend to occur in patients who have had this condition for a very long time. Unfortunately, there is not a quick fix for the treatment and management of blepharitis, and the onus is upon patients to ensure that they regularly maintain and practice good lid hygiene, and this will ensure that the condition that they have is kept at bay. Also, what will happen through regular treatment, and what I mean by regular treatment is treatment even when one is not experiencing any symptoms. This will ensure that when one does experience a flare-up of their blepharitis, their symptoms tend to be less severe in terms of severity, and they also tend to get the symptoms less frequently. Therefore, it is fundamentally important to ensure that a routine is initiated by patients and maintained over time, even in the absence of active symptoms. There are 4 core steps that patients need to ensure that they carry out regularly as part of their overall lid hygiene practice to keep blepharitis at bay. The first step in this treatment program is warm compress or warmth, and this can be carried out via 2 different methods, or a combination if one chooses to do so. Ultimately, you can either use a warm flannel, or one can use something more commercially available, such as a eye bag, this one being known as a Meibo patch. And ultimately, what one is trying to do with these patches or with the flannels is, once they have been heated up to a sufficient temperature, it's also always important to ensure that you check the actual flannel or the bag on your skin beforehand to ensure that it is not too hot. in so much that it will cause you to experience a burn. Once you have warmed up this bag or flannel, you then simply take your glasses off and take your contact lenses out, and you place it over the top of your closed eyelids like this. You do that for roughly 10 minutes or so, and this then completes the first stage of the treatment program. What the warmth is doing is loosening up the blocked glands, which are blocked with an oily substance, and it's making the scaly bits of sleep that are in and amongst your eyelashes loose and more mobile, so that in the coming steps of this treatment program you can remove them more easily. The benefit of using something such as this, which is the Meibomian patch, is you can simply pop it into the microwave for approximately 30 seconds or so, and then you can pop it onto your closed eyelids once you have checked that the temperature is suitable. So I do find that they are very, very convenient to use. After one has carried out the warmth element of the treatment program, one now needs to massage their eyelids in order to actually help to expel the contents of the blocked glands. The best way to do this is, again, take out your contact lenses, take off your glasses, and close your eyes, and then simply, if this is your top eyelid, you take your finger and you gently massage down on top of your closed eyelid. So for the top eyelid, you go from top to bottom like this, which follows the natural path of your gland and ducts, and then for the bottom eyelid you go from bottom to up, which again will help to expel the contents of the blocked gland. It is important to carry out this massage step approximately 5 to 10 times for both the upper and lower eyelid. It is also very important to ensure that you are firm but neither too gentle or too abrasive with your massage technique. One now needs to clean their eyelid margins and their eyelashes. Historically, patients have been advised by healthcare professionals to use either a cotton bud dipped into either Johnson's baby shampoo with lukewarm water, or a cotton bud dipped into a solution containing bicarbonate solution. More recently, patients are now also given the option of using preparations such as eyelid wipes that are specifically formulated for this purpose. In terms of the cotton bud technique, once the solution of choice has been decided upon, one simply will get the cotton bud, dip it into the solution, and then looking into the mirror, carefully pull the lower eyelid down and gently wipe across the base of the eyelashes and the lid margin. Once that has been done, the opposite end of the cotton bud can be used to do the same for the top eyelid. It is then advisable to use a clean cotton bud to repeat the same procedure on the other side. So in terms of using one of the commercially available products, if one unravels the sachet that they come within, then one will get a wipe that looks something like this. For demonstration purposes, this is just a normal tissue. What you can then do is simply pop one corner of the eyelid wipe over your index finger, and then simply clean the bottom eyelash / eyelid margin. You can then use the opposite corner to do the same for the top eyelid, and then once you have used these two sides, you can then turn the wipe over and repeat the same process and steps to clean the eyelashes and eyelid margins of the second eye. The final step in the treatment of blepharitis that several patients find to be advantageous is the use of artificial tears. This step is, however, not always advised by healthcare professionals, and some patients feel that they do not need to include this step. However, some patients do find that after carrying out the above 3 steps, particularly after carrying out the cleaning process of the lid hygiene overall management program, bits of debris can get into their eyes and cause irritation and discomfort. Therefore, by using artificial tears, they are just lubricating their eyes and just overall getting a nice feel to their eyes at the end of the treatment program. It is important to remember that this lid hygiene practice protocol, which I have described as being 4 steps. However, as I have mentioned, it can also be a 3-step program, needs to be actioned and maintained regularly, and typical regimes advised by healthcare professionals would be something along the lines of carrying out all 4 steps twice a day for a minimum of 2 weeks, particularly during when one is experiencing an active flare-up of their blepharitis. A treatment regime and protocol may need to continue beyond 2 weeks if it is deemed necessary to do so. For ease of adherence and to minimize the impact and disruption to one's life, it is advisable to incorporate these lid hygiene practices into one's daily routines. Some patients therefore find it beneficial to carry out this treatment program shortly after brushing their teeth, which they tend to do twice a day, once in the morning and once in the evening just prior to bed. What may also be advised for your particular blepharitis is the use of antibiotics, which may either be a short-term thing and may simply involve using antibiotic eye drops. If it is deemed by your eye care professional to be necessary to do so, sometimes tablet or oral antibiotics may very well need to be prescribed in order to help to manage and treat your blepharitis. Doxycycline is typically an antibiotic that is frequently used for this purpose, and if it is initiated, it may very well need to be used for several weeks, if not months. Have you ever had blepharitis? If so, how did it affect you, and what treatment program and protocol did you find to be of benefit in treating your condition? Please do share your story, as I would love to hear from you. A few final points just to mention prior to finishing include: number 1, some patients find that during an acute flare-up of their blepharitis, wearing eye makeup can become problematic, particularly eyeliner. Therefore, some patients tend to avoid such products during acute flare-ups. Also, it is advisable to always check that your makeup products are within date, and also to avoid sharing makeup products with other people, because then cross-contamination can become an issue. The second thing to remember is that when one has blepharitis, their eyelid margins are inflamed, red, irritated and angry, and if one engages in rubbing their eyes, this can exacerbate their symptoms and therefore should be avoided. If your eye care professional identifies an underlying health problem that is either directly contributing to or causing your blepharitis, such as seborrheic dermatitis or acne rosacea, then it is important that you see your general practitioner or family doctor in order to best control and manage these underlying healthcare problems and issues. Thank you for watching this short video about blepharitis. We have discussed today what blepharitis is, what causes blepharitis, what symptoms patients with blepharitis tend to experience, how the condition is treated, and remember the core 4-pronged attack approach, which needs to be carried out typically at least twice a day for at least a minimum of 2 weeks, potentially longer, and the importance of incorporating this into one's daily practice and routine, such as after one brushes their teeth, to reduce disruption and improve adherence of maintaining this treatment protocol. It is important to remember that blepharitis treatment and management, if maintained properly over time, can help to reduce the frequency and severity of symptoms. Blepharitis is a condition that sadly and unfortunately does not get cured through one treatment regime and protocol over a few weeks. It is important to identify symptoms that may indicate a recurrence of blepharitis, seek professional help with achieving a diagnosis, and then maintaining and initiating a treatment program and protocol. I hope you have found this video useful, and please do share any comments with myself below in the comment box. Please do share this video with family and friends. Blepharitis is a very common condition, and you would be surprised how many patients do suffer with the issue over a prolonged period of time. Therefore, please freely share this video with the relevant people whom you feel may benefit from it. If you have found this video useful, then please do subscribe to my channel in order to help my channel grow so that I can reach more people with relevant eye-related content. Thank you so much for listening and spending your valuable time with myself. Stay safe and be happy. Thank you.